An ingrown toenail can be painful. Learn what causes this condition and how it can be treated. Answers from AboutKidsHealth.ca at the Hospital for Sick Children. An ingrown toenail occurs when the side of the nail grows into the surrounding skin instead of straight outward. As it grows, the nail cuts into the skin, often causing discomfort and pain. It can also lead to infection and inflammation. Ingrown toenails are a common problem in teenagers and young adults. How does an ingrown toenail affect the body? An ingrown toenail is most likely to occur on the big toe, but any toe can be affected. At first, the skin around the nail may become red and feel slightly sore. With time, there can be more pain and swelling. Small openings in the skin can allow bacteria to enter, which can cause the area to become infected. An ingrown toenail can have a number of causes, including shoes that are too narrow or those that put pressure over the nails are more likely to cause ingrown toenails. Over-trimming of the nails or rounding the edges instead of cutting straight across. Tearing or picking at the nail, repeated pressure or trauma to the nail, for example during sports. Certain nail or toe shapes, such as curved nails that grow downward. All of these factors can make ingrown toenails more likely. Some of these conditions may improve on their own over time. A healthcare provider can diagnose an ingrown toenail by examining your child and asking questions about how they feel when they walk. Inspect your child's feet often to look for any signs of an ingrown toenail. One early sign is redness and swelling of the skin near the edge of the nail. If the ingrown nail is infected, your child may develop a pus-filled blister or redness that extends around the toe or towards the foot. Your child may also complain that their foot hurts or may limp or wince when they walk. Several options are available to treat an ingrown toenail. The early signs can be resolved by wearing wider or open-toed footwear, trimming nails straight across, finding ways to allow the nail to grow out of the skin, for example by using tape to pull the skin beside the nail out of the way. Other treatments for ingrown toenails include soaking the foot in a mix of lukewarm water and mild soap or 1 to 2 teaspoons of Epsom salt for 10 to 20 minutes 2 or 3 times a day for 1 to 2 weeks. After soaking the foot, dry the area and apply a topical antibiotic ointment around the ingrown toenail. During the day, while your child is wearing shoes, the toenail can be covered with a bandage. At night, the bandage can be removed to allow the toenail to air out in bed. Using a short piece of unflavored, unwaxed dental floss to gently separate the skin of the toe. Place the floss diagonally under the corner tip of the ingrown nail. If an infection develops, your child may need to take antibiotics to treat it and prevent complications. In rare cases, your child might need surgery to resolve the problem. There are many ways to prevent an ingrown toenail. Some of these include trim toenails straight across and not too short. After baths or showers, while the nails are still soft, try to bend the toenail corners upward. Make sure that your child's shoes are not too narrow or too tight. Choose shoes with a wide toe box to avoid crowding. If my child has an ingrown toenail, is there any way to prevent infection? Try not to dig out the nail or cut away ingrown skin yourself. Bathroom surgeries, over-manipulating the ingrown nail, can cause infections. Stick with gentle treatments described in this video, including soaking, taping, or using clean dental floss. If infected, the skin may become red, swollen, and painful, with yellow or green pus and a foul smell. Over time, skin may overgrow around the nail, worsening the pain. If left untreated, an ingrown toenail can sometimes lead to skin infections and rarely bone infections. See your child's healthcare provider if you noticed early signs of an ingrown toenail and you are unsure of the diagnosis. Your child's symptoms continue after you have treated the early signs of an ingrown toenail. Your child complains of pain across the toe. Your child has fever or shows signs of infection beside the nail, such as redness, pus, or a bad smell. For more information about ingrown toenails and other health topics, visit AboutKidsHealth.ca.